Hello and welcome to Talk Time. Parenthood, motherhood. These kind of conversations are nowadays becoming a lot more. Back in the days, we used to simply consider people get married and have children. Now it all has changed. Women want careers, and even fathers nowadays want to be financially secure. So do women. And then plan a child. Unfortunately, in that, the clock, which we keep talking about, is ticking. And when is the right time to have a child? And now you have so many other things, like your environment around you, your lifestyle, the level of stresses we all have, all causing issues when you talk about pregnancy. Well, today I have an expert. I have someone who's going to decode all this for us to help you understand what is actually a right age, what is the right age to if you want to freeze an egg, what is the right age to plan a baby, what should be your mental and physical and biological age for all these things. Dr. Tanya is joining us on Talk Time to tell us more. Dr. Tanya, thank you so much for joining us.
Thank you.
So first and foremost, the conversation nowadays, you would, as a doctor, you would say that majority of your patients who are wanting their first child, nowadays is shifted more towards the 30s, and I would say more towards the mid 30s, because people want, their careers and financially to be far more secure. But then there are so many complications nowadays that we experience. Can you tell us what is actually, as a doctor, you would suggest biologically, looking at everything around us, what is the right age to plan a baby?
So I think you're very right in saying that there has been a change, and there has not only been a change in the time of parenthood for women and men, but also when they get married.
Yes.
So there was a time where our grandmoms got married when they were 12 and 13 to then being married in their late 18, 19, 20s to now where women are choosing their partners and are choosing to become mums in their mid to their late 30s. So while science tells us that when is the peak of fertility, it is in your 20s.
Okay.
So we have to be mindful of the fact that the fertility and the fertility window for women is different and for men is different. Yes. And as you said, the choices are for both, because when we're going to be a parent,
yes,
we have to be mindful of what is the biology of the woman, what is the biology of the man, and it's not just our eggs. It is our overall health. It is also the health of our womb or our uterus. So when we look at one aspect, which is our egg reserve or our ovarian reserve, which is really talked about, what are we looking at? One is our age. And the younger you are, you've got a better cohort of good quality eggs. And just as we would say, it is not about numbers, it is about quality.
Yes.
So the peak fertility, being in their 20s and being in the early 30s, came from the fact that we had a good reserve of good quality eggs.
Okay.
Same for the man. So if you have a younger man, the quality of the sperm is much better. But men produce sperm all throughout their lives. Whereas women, we're already losing our eggs as soon as we are born.
Okay.
So the clocks are different. We talk about aging in women, but I think we have to also focus about aging in men, because the genetics that comes for a child comes from the genome from the mom, the genome from the man, and together also influenced by something which is called epigenetics, which is our environment. So as you said, is our environment the same? It's not. We've all had this, in the last couple of weeks, conversations
yes,
about AQI, about everybody seems to talk about how badly it's affecting our lungs, but it affects beyond the lungs. It affects our whole body. It can affect our cardiac health. It can affect our ovarian health. It can affect the men's sperm. When we look at our fertility and when we've had a deeper dive into our fertility unit and even looked at seasonal variations, even looked at what happens when the AQI is bad, we've seen fluctuations.
Oh.
So we have to be mindful of that.
Absolutely. Our environment, we have to be very mindful of that. And our environment from a younger age, as we spoke about. Nowadays, we have children at the age of 12, 13 who are vaping. We have people who are out there doing hookah, considering it's a social activity. I don't smoke. I just do a hookah once in a while. It's horrible. It is actually so bad for your health. The kind of food one consumes, as well as the kind of workout one does. We were talking about that as well. Unfortunately, we've reached an age, forget about doing house chores. Even if somebody during COVID also asked us to do house chores, we would pick up a Dyson, a vacuum cleaner, and maybe a mop and do it with our hand. We would not sit down and do it. whereas those kind of things always helped in pregnancy.
Absolutely. And I think, as you said, it is about our diet, it's about our lifestyle, it's also about our sleep cycle. I think we know, all of us have these conversations about our circadian rhythm. We talk about how the hormones change, how there's an interaction between the higher glands in the brain, which is called the pituitary, to the rest of the body. We talk about compounds where younger generation is now suffering from mental health issues, they're suffering from sleep issues, blood pressure, cardiac health. We have to really be mindful of that. So we talk, I've had this conversation with my young boys and, as you said, AQI outside. What about when they go clubbing? What is the AQI in the club? Where doing a hookah maybe just, it's not as bad as smoking a cigarette. It's not as bad as vaping, or it's not as bad as having weed, because in the larger scientific realm, there was some article which suggested that really CBD may be okay for a certain set of patients. But you have to see the complete picture.
Absolutely.
And as you said, that again, younger kids, younger societal pressures. It's not just pressures of being a parent, which comes into play when you're in your 30s, but even at the age of being a teen, when they go into a party. Is it the cool thing that you've tried alcohol? Is it a cool thing you've tried a vape? Is it a cool thing to say, okay, I tried weed and it did nothing to me?
Yes.
So we have to also educate our youngsters, our parents, and say that it's not, is a vape or a hookah as bad as a cigarette? What is your standard?
Yes.
Is it versus doing nothing but eating healthy, living healthy, and breathing pure oxygen?
But do you consider that nowadays, now we look at, it is the world of social media.
Yes.
So celebrity lifestyle always has impact. It's not even today. It's always impacted over the years.
Absolutely.
Now we see a lot of these celebrities promoting a good, healthy lifestyle, working out, and also eating clean.
Yeah.
We are coming down to a life where we are seeing clean cosmetics, people talking about clean cosmetics, because that also has an impact. Everything has an impact on your lifestyle. Clean eating. How do you suggest people who are planning a family, what is clean eating? Because unfortunately that clean eating also is, I'll be vegan so I'm clean. That's another problem people have. So what is clean eating as a doctor?
So I think just carrying on the conversation, as you said, we have enough scientific evidence to say actually that we are also what our mothers ate. Okay. So it is, we're going beyond to say that from really our teens as well, because there was something called, the plastics industry, as you said, even in cosmetics. It's sad to hear and see science telling us that in breast milk we have particles of plastic. So really, we think we're doing, as you said, we're vegan, or we're really doing a healthy diet and we're having fresh fruits and veggies. But are they as healthy? Are they truly organic? Are they sourced from the right place? We don't know when we have our summer seasons. So the juicy, the mangoes that we're having or the melons that we're having, are they as healthy? Are they, but these are certain things which may not be in our control. What is in our control, we should work on. So our control is our lifestyle. Our control is to say that a balanced diet, as we say, a rainbow colored diet, you should have your fruits, you should have your veggies, you should have enough, salads in your diet, enough fiber, water. So I think when we also look at exercising, it makes you more conscientious about, am I eating the right amount of protein? Do I have enough fiber? Do I have enough fruits? Do I have nuts? Do I have enough legumes? So, again, there are fads and crazes which the younger generation follows. So definitely, as a responsible society, that's the message. So it's great when we have people from the industry promoting a good lifestyle, when we have an ad which says that we're fit and we are from, your transformation journey, which is realistic, and you're actually exercising, walking the talk. So if I tell you that you should be having a mix of fruits and veggies and nuts and exercising 30 to 45 minutes of cardio-intensive exercise, you should be drinking 3 to 4 liters of fluids, I should also be a role model. Absolutely. A role model as a society, a role model as a mom, a role model as a teacher, as a friend. Our woman gang should be a gang which is, okay, let's have, so at my Pilates studio, it was really exciting to see that there was a party of all the girl gang to say, that's the way we're going to have a party. at the Pilates studio,
Absolutely.
everybody together, with their
promoting a healthy
drinks.
lifestyle. Yes, that is essentially very important. Where we talk about a healthy lifestyle, well, we talk about having a child, we talk about gaining weight.
Yeah.
A problem that persists, continues, and people have a big problem. And then we have something like Ozempic.
Absolutely. So
now, as a doctor, what do you suggest? Like, how should people, weigh all these things together?
We all have to know what is our own health. So we were discussing about our own health checks.
Yes.
Every 20-year-old is not same. Every 16-year-old is not same. Every 30 or 40-year-old is not same. We all know about BMI.
Yes.
We all know that you can come to a health center and get your body overall analysis. It is not just available in the gyms. When you meet your doctor, you get a basic assessment. You get your blood pressure checked. You get your rest of the body checked. You should also be looking at your BMI and saying, is it optimal? Is it not? So I think as a society, we have to also understand, as Asians, our cutoff for even something like diabetes is different from the West. Okay. So is a BMI of 28 for an Asian same as a BMI of 28 for a white Caucasian? It's not, because our genetics and our history is different from them. The way our body responds is different to the way their body responds. Then how is, even within the tiers of cities we've seen, is the health of someone living in the village different from someone who is living in, for example, for us guys, if we are in Delhi NCR?
Yes.
Right?
Absolutely.
We want to move to the hills. We want to get better air. We want to get a fresh fruits. We want to grow our own oranges and apples. Whilst some people can do that, some people cannot.
Yes.
So when we are being mindful of our health, one is your food, one is your fluid consumption, your water, then comes to the point of even alcohol. How many of us are mindful of the units of alcohol that we're taking? So we may say, there's not much in a beer, a wine's healthy, but a bottle of wine a day is not healthy. What is healthy?
I think that is what is more important. Actually asking an expert, asking what is actually healthy for your body. That's when I wanted to ask about the Ozempic question, because a lot of people want the doctor to just prescribe Ozempic to them.
Absolutely.
And especially after pregnancy, women gain weight and they're not losing the weight. What would you tell them?
So it is really not the magic bullet that we think it is. It is fantastic for a certain sect of people. It is, again, a scientific innovation which has to be tailored for the right patient who really needs it. So is there a health concern? So it's not only Ozempic. So we have a specific label to these medicines, and it could be an oral medication. It could be either the Ozempic or the Wegovy, which is given for a particular health indication. Are we looking at getting a better cardiovascular health? Are we looking at, in the long term, that as the weight would reduce, our lipids would become better, our status of our blood wells would become better, we would be at a lesser risk of getting a cardiac health issue because of our overall health parameters? But let's say if today you and me, if our metabolism is okay, our BMI is okay, we do not have diabetes, we do not have a lipid disorder, we do not have blood pressure issues, our family history is okay, should we just have Ozempic because my waist size went from a size 26 waist to a size 30? No. But patients are reaching out to saying that, again, the media claims it's fantastic weight loss benefits. So is it the easy way out? Should I just go and ask? And there are patients who come and say, doc, why don't we just take the Ozempic for a bit? And within, a couple of weeks, my weight will start shedding and it will be the magic bullet. It's not.
That is the unfortunate. Everybody wants a quick answer.
But also to that, it will not work if you're not exercising and working with your diet and with your lifestyle. So if we look at weight loss and overall health, we are ultimately losing weight to optimize our health. So where is the overall health coming from? We go back to our diet, we go back to our nutrition, we go back to exercise, because there could be a problem with losing muscle mass. Yes. If you lose muscle mass, that may not be the best for your health. And as women, again, we have to be mindful about our bone health. We don't talk enough about how it affects our bones when we're, especially in our perimenopause, what we can do when we are younger. So to our youngsters, when we are young adults, we are actually accumulating the maximum amount of our bone health. So if we're eating well, if we're exercising, we're having our best sleep cycle, then we're actually giving our body the best chance in the 40s, in the 50s, and in the 60s. So whilst as an age we have improved upon our health, we've improved upon the age and our longevity. How is that longevity? How healthy is our longevity? We talk about, 60 is the new 50, 50 is the new 40. But we are also looking at various disorders which have started. We're looking
Yes.
at a huge realm of cancers in the younger age groups. And it's not just with smokers, not just with people who are drinking.
It could be with anybody. We're
Anybody.
noticing it is with could
So,
be with.
as I said, there are certain influences which are because of our genetics. There are certain influences because of the environment.
Yes. But the others that we can take care of, we should
Absolutely.
absolutely take care of. Something that I would really want to ask you, as you mentioned also, menopause.
Yes.
Pre-menopause, menopause. We're seeing a lot of the generation now hitting pre-menopause much earlier than before. And I consider that the things that you pointed out, your lifestyle, your workout, and obviously things that you've done in your teens has a massive impact. What are the signs of pre-menopause, as well as how are women supposed to deal with it? And when is the right time they should come to a doctor and have a conversation about it? Because I think it also has an impact on their sexual life, mental life, a lot of that.
So I think I'll just take a step back. And as we said, that as a woman, right through the phases, and our journey begins from the younger years to our adolescence, to our 20s, our 30s, to the time where we want to become mums, to become parents, to our perimenopause, to the menopause. I think just like we're talking about health, we should talk about sexual health, we should talk about bone health, we should talk about overall health. Sometimes it could be just something as simple as I'm not able to sleep well. Could that be a harbinger of a health issue? Could that be a symptom of perimenopause? We are getting younger women where their egg reserve is declining even in their 20s. So there would be a time where the tongue topic was PCOD. You
Yes.
speak to any girl and she'll say, oh, my skin is not right, or my periods are irregular, it's PCOD. Now, sometimes we have women coming to us, Doc, my periods are not the same, I'm having erratic cycles, the flow is less, I think I have PCOD. And when we actually evaluate them, it's not PCOD, but it's your egg reserve is declining. And that would in the future lead to potentially a chances of having an earlier, perimenopause and a menopause. So if anything in your body doesn't fit right, it could be your periods, it could be your mental health, it could be your sleep pattern, it could be mood changes, it could be your sexual drive. So everything has to be looked after and taken into consideration. So I think just like we have yearly checks, come and visit your gynae. And it doesn't mean that you're going to meet your gynae or a fertility person or a sexual health specialist because there is a problem.
Yes,
Sometimes
that
it's
is
a
the
conversation like we are having.
Unfortunately, that is the problem. That is why I wanted to have this conversation with you, because majority of the people want to go to a doc or to a specialist only when they consider there is a problem.
Yes.
The conversation, communication is a problem that you can just go and check on. Just do a health check. So you need to do all these checks as well. Before I let you go, a very important question. What is the right age for someone to freeze an egg? Because now it seems, because again, just I mentioned, when celebrities talk about it, people start to consider it a lot more. And we're seeing a lot of celebrities coming out and talking about, oh, I freeze my egg at my 30, at my 31, so that if I want a child, I can. What is the right age and what all comes along with it? Because people just think, oh, you just go freeze your egg.
Absolutely.
It is not that.
So I think one which we've again talked about, and I would reiterate, is the fact that the younger you are, the better your egg quality. Now, just as in our minds, we think we're never too old. If you ask me, I'm still a youngster and I definitely feel it. But is the biological clock same as the way I perceive as my age? It's not. So if age is defining for the biology of my ovaries and for the sperms, as I'd like to reiterate. So if your 20s and your early 30s is the peak of your fertility, that would be the best time to freeze either the eggs or look at fertility even for men to have an assessment. Okay. Now, why? Because younger age group, better quality, lesser numbers. So there is a lot of even stigmas attached with it still, but the fact is that we're talking about it. The fact is that the society is accepting it. There are companies actually giving the female employers the benefits of insurance, especially about egg freezing, which was a taboo initially. We would not be having these conversations. So yes, it is a fertility option which is there as a choice to make. But does that guarantee a pregnancy? No, it doesn't. So what does it do? As you said, sometimes I'll have patients come in and saying, Doc, I've decided this is the right month. Can we just do it now? First of all, get yourself assessed. Get yourself seen. Is this the right time? Is it the right procedure for you? When you should do it, how should you do it? It is almost like a mini IVF. So when we tell them you'd be taking fertility hormone injections, and they'll be like, daily injections? So there are new ways where we can use milder injections, sometimes taking tablets and lesser injections. So it would be tailored to your egg reserve, your overall health, and then it has to be something which is seen by a specialist, guided as per your response. So when you start taking the treatment, it is going to take a couple of days for your follicles, which would bear the eggs, to grow and mature. And then there is a surgery for us to retrieve that fluid. And when I ask, and when we did a survey, actually, as I was discussing with you, amongst, we handed out a survey on egg freezing to anyone from 18 and above, there were so many interesting facts we realized. Some of them didn't know it's a surgery. Most knew you need some sort of hormones you take. Some of them didn't know that the process in the lab is actually done by a group of scientists called embryologists. And even patients, when they come, they do not know. They think we are freezing only eggs. There are various types of eggs. If I just asked you, do you know that different type of eggs?
I wouldn't.
Correct.
That is exactly, that is the reason why I wanted to ask you all these questions, because there's a lot of misinformation.
Yes.
And there is a lot of lack of information. That is what the real problem is, because people want to do it, but they don't know what really goes in it. And they're very, very scared to ask experts for some reason.
And again, sometimes, people think of it as a commercial angle. They think if I go to a doctor, they will say, okay, this is something raging in the media. And if I meet her, and maybe if one of my egg reserve parameters is lower, it would be definitely you should do it. Weigh the balance, the pros and cons. Do you think freezing your eggs when you are 31, 32, or even 35 may be better, or having this conversation when you're 40? We don't think that ahead, because do we have the maturity to think what will happen at 40? We don't know what can happen in those 10 years between 30 and 40 medically. COVID came as a big bang. Did we expect it? We didn't.
Yes.
We don't know. There are changes which can happen to our health, which can be our cardiac health, which can impact our health to be a mother. It could be changes with our uterus and our womb. Egg freezing is just one part of the process, and we must understand there's attrition at every level. There is a scientific advancement. That is why egg freezing from an experimental process has become an established scientific process. But it doesn't stop at freezing eggs. If you wanted to be a mum, we have to go beyond. We have to make an embryo where we would need a healthy sperm. Then we would need to implant it within our womb. So our uterus has to be healthy. It has to be receptive. Our health has to be good. There shouldn't be complications with other medical disorders. For example, thyroid problems. For example, sugar problems. For example, our weight. And when we are in the picture perfect health, do we get a success? But is there the right time to be extremely healthy? Sometimes I have patients come in and say, doc, even our friend conceived in her late 40s. She has smoked. She used to drink. She made a baby so easily. Look at me. I don't drink. I don't smoke. I'm healthy. And this is my third attempt of IVF. It shatters them. Yes. We have to understand it is not a guarantee. It's not 100%. It is age related. But that age is not defined just by the woman. It's defined by the man as well. So is the sperm what a 45-year-old, same as sperm from a 35-year-old? It's not.
Yes.
So to become a parent, you not only choose the freezing at the right time, but also the step ahead. to use it
I think
to
that
become
that is very important for people
pregnant.
to.
Yes.
That is what is very important. And thank you so much for being with us today and explaining this. I'll have you on the show again because I know there are a lot more questions and I can't put them all together in one day. But thank you so much for sharing all this insight. And I hope that a few of our viewers are able to understand what's the real way of freezing, what is actually menopause, and what is actually your physical health, which is most important. Thank you, Dr. Tanya.
Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.